Hello there, this is Dana Arcuri, author, speaker, and wellness advocate, and today's topic is about chronic pain linked to PTSD and sexual trauma. And so there could be different forms of chronic pain that people are experiencing. It could be all over pain, it could be fibromyalgia pain, it could be back pain, and it could be various autoimmune conditions. But over 10 years ago, after I had been diagnosed with primary fibromyalgia, I started to connect the dots between the body-mind connection, and I started reading all kinds of very informative books. Some were holistic, some were written by doctors, and they were to do with how there could be early trauma or some form of traumatic experience in a person's life in which later in life there could be this manifestation of physical and emotional pain that suddenly shows up, and then an individual's diagnosed with whichever conditions it may be. But the fibromyalgia is one that is greatly linked to early trauma, late trauma, and sexual abuse. So it's really interesting. It's something that I've done research on in the past. I'm doing a lot more research now. And here is just a little bit of info in regard to the fibromyalgia, trauma, and PTSD. Okay, so for one, I think it's interesting that when I was being tested in the very early stages in early 2008, for every imaginable condition. So the doctors pretty much kept an open mind when it came to autoimmune disorders, or even like rheumatoid arthritis. So many different symptoms can overlap other conditions. And so the doctor said there is no medical test to prove that someone has fibromyalgia. So what they do is they take medical tests of usually blood work to determine if a patient has another condition, such as hypothyroidism. And so for me, it was interesting that back in March 2008, they had done over 30 plus tubes of blood. I have never had that much blood work to rule in or rule out fibromyalgia plus all these other disorders. So for me, they did check various testing, Lyme disease, lupus, thyroid issues. I mean, there was just so much blood work, and none were positive. Now, my big concern, of course, is that they didn't check for things like food allergies, mold exposure, and they never considered the person holistically, as in body, mind, spirit. So they're missing a link in the traditional medical community. They're missing this really vital component, which is the psychological component. Nobody asked me, were you ever abused as a child, as a teen? Were you ever raped? Did you ever have domestic abuse? Did you ever have any kind of physical, emotional, or sexual trauma? So nobody asked me that question. Nobody asked me, some very important questions that could be linked to PTSD and trauma. So that is disturbing to me, but of course I did my own research, and I have come across, like I said, plenty of scientific and medical evidence that there is a link between PTSD, trauma, all forms of abuse, and fibromyalgia. So, there's all this evidence. And so today I wanted to talk about it and to just share what I've discovered. And you could either take it with a grain of salt, you could do your own research, you could learn and gain some insight from this video. Of course, I always say do your own research, educate yourself, because it really is empowering. Okay, so let's go on with, according to National Pain Report, 7 out of 10 women with chronic pain have one or more incidents of childhood trauma. According to the results of the survey that have found nearly half the women had experienced emotional abuse as children. When we go onward, they say, whether you acknowledge it or not, childhood trauma will impact your health, your emotional well-being, and your pain levels. It does. It's just a fact. And this is Dr. Let me get her name straight. Dr. Darnell, who has a PhD. She is a pain psychologist, and she's the author of the book called Less Pain, Fewer Pills. She says if you are exposed to trauma and you're a woman, you are more likely to subsequently develop chronic pain. And then she goes onward. Trauma and sexual abuse unequivocally predicts the development of chronic pain later in life. That doesn't mean that people are saying it's your fault. It's not your fault or anything like that. But science is proving that there's this link between chronic pain and trauma. So then I went onward and I checked out countless websites. According to the National Pain Report Survey, women who reported childhood sexual abuse were more likely by 69% to have fibromyalgia than women who were not sexually abused. Very interesting. It seems like our statistics are getting higher now. The Institute of Chronic Pain says, okay, here we go, over 90% of women with fibromyalgia syndrome report that either they did have abuse during their childhood or adult life. Trauma is the psychological and bodily response to experiencing an overwhelming, terrible event. So, we could look at different events, and of course this isn't all of them, but here's a glimpse of different trauma-producing events. Combat. You're in the military, you go to war, you see a whole lot of stuff that is violent, graphic, and traumatizing. Number 2, sexual assault, domestic violence, natural disasters, and physical and or sexual abuse in childhood or adult. Let's move on. After experiencing traumatic events, patients tend to develop certain predictable reactions. So here's some reactions to how patients respond after they experience trauma. They have persistent and unwanted thoughts, memories, and dreams of the event. They may have a heightened psychological arousal, such as tension, nervousness, irritability, startling easily, poor concentration, poor sleep. Next, the patients may avoid places, peoples, and things that are directly triggering memories of the trauma. Okay, so I wanted to discover for myself, is chronic pain truly PTSD from trauma? So chronic pain, is it really linked to PTSD and trauma? And so here we go. The website called Fibromyalgia News Today states, quote unquote, women with fibromyalgia have a higher prevalence of post-traumatic stress disorder known as PTSD. Recent studies have revealed that emotional trauma could lead to developing chronic pain, including fibromyalgia and back pain, plus there's a whole list of other autoimmune conditions that go hand in hand with this chronic pain. During various forms of trauma, especially sexual assault, the body goes into fight, flight, or freeze. Some females can spend decades avoiding discussions, treatment, and so forth pertaining to that trauma. Some people, it is so painful what they went through that they use the avoidance factor. They just avoid discussions, treatment, or anything to do with it. Sometimes they keep it a secret for life because it is so humiliating. It is so traumatizing. They just can't even share it with their best friend, their spouse, their parents, no one. Next, after a sexual assault, women can experience a wide range of reactions, and it's very important to note that there is no single one response. There's so many that are common, and that many women do have an immediate response, and others may have a very delayed response to sexual assault. So here is a little glimpse of some symptoms, early reactions to sexual assault that women experience. And let's keep this open-minded that, men who are sexually assaulted could experience very similar emotions. They may experience shock, confusion, anxiety. They just feel numb. They might go into denial. Strong memories of the assault, and they just can't ignore it. They might have insomnia, nightmares, major depressive disorders, anger. They feel violated. They're humiliated. They have shame and guilt. They may have social problems. They just can't get out there and socialize anymore. They might not even be hanging out with their friends or family. Their life may have traumatically changed. They may have sexual challenges. Maybe having intercourse can trigger some old memories, and it's again reliving the trauma. They might have some alcohol and drug abuse. It may be so overwhelming, just so overwhelming to deal with these heightened emotions that they want to just numb out to medications, drugs, or alcohol. And last, PTSD. So PTSD is a symptom of sexual assault. So we're going to move on now. Let's talk about PTSD. Here's the symptoms that most doctors look for. Repeated thoughts of the assault, nightmares, sleep issues, you're tired yet wired, you can't concentrate, you have anxiety, avoidance, you avoid the people, places, and things that remind you or trigger the horrific experience you went through. You have irritability, moodiness, your personality is starting to change. You're easily startled, you are tense and on edge. You may have scary flashbacks and disturbing memories. You can have some angry outbursts, negative thoughts towards your own self or others, loss of interest in activities, forgetfulness, memory loss, repressed memories, and secondary trauma. So you could be reliving the trauma when, say, you're on social media and you're seeing a lot of the Me Too hashtags, you're seeing the whole hashtag why I didn't report it, and it could just trigger some horrific memories, and it could just really start you on a path to high anxiety. Next, we have to understand that in addition to the PTSD, there are fibromyalgia symptoms too. You're fatigued, you're tired all the time, you feel out of it, you're kind of like living in a fog. You have emotional detachment. You may have forgetfulness, memory challenges, digestive issues, IBS, inflammation, stomach ache, brain fog. Your body hurts all over, you just ache, your muscles hurt, sometimes even your bones hurt. You have increased physical pain and inflammation. And there's hope for healing. There's hope for healing naturally. Let's talk about some natural, wonderful benefits. You could seek professional counseling. You could talk to a trustworthy friend. You could go to art therapy, music therapy, professional massage therapy, CBD oil, essential oils, journaling, herbal medicine, acupuncture, meditation, prayer, and some people even practice yoga. So there's a handful, just dozens of holistic approaches you could use to reduce that anxiety, to kind of relax yourself, and to try to take back control of your body and mind. So today, consider this. Feel free to share your own story. If there is some form of holistic approach that works for you, for PTSD, trauma, or any kind of forms of abuse, feel free to share. And you could go to danaarcuri.com for wellness tips and inspiration. Thank you.